Hello, everybody. I would like to welcome everyone to today's webinar entitled How Telemedicine is Transforming Healthcare in the Age of COVID-19. My name is Steve Rosenthal, and I'm the CEO of Triton Benefits and HR Solutions. We're one of the nation's largest insurance brokerage firms, headquartered in Woodbridge, New Jersey, with regional offices around the country. Also presenting with me today is Madison Hibbler, who works for Teladoc, a New York Stock Exchange company and the largest telemedicine provider in the nation. During this segment, we encourage you to use the question panel on the right and type in any questions you may have. At the end of the presentation, Madison and I will answer your questions. Before we begin, I'd like to ask just two polling questions so we can get a better understanding of our audience today. So let me ask the first polling question. And the first polling question is asking if you currently have a telemedicine program in place today. And I will do some voiceover while you're doing this. I would tell you over the last probably 72 hours, more and more health plans have now embedded some form of Teladoc into their plans. So if I asked this polling question a month ago, I'm sure I got a little different answer than I get present today. So collecting the responses, I'm going to give it about another 10 seconds. And I'm going to close the poll. And 63% do have some type of telemedicine in place today. 37% does not. So that poll is closed. And I'm going to do one more polling question. And what is the level of knowledge when it comes to telemedicine? Basic, advanced, or I do not have any knowledge at all. And that's why I'm on this webinar today. While you're doing this, think about behind the scenes how this all works. You have some very, very qualified medical professionals that are working in hospitals that actually have their Uber switch that they can turn on. Certainly now they're motivated to turn on more than ever and start taking calls utilizing the telemedicine apps that are out there today. So, all righty, I'm going to close this down. And we have 59% have basic knowledge, 5% advanced, and 36% could now use some additional knowledge. Great. Okay. Well, that certainly helps, and I wanted to thank everybody, and hopefully everybody can see my screen. All right. So as you hear in the news more and more today in almost every press briefing, telemedicine has gained a newfound relevance with the coronavirus pandemic. Years ago, we talked a lot about it with all of our insureds. Today, it's becoming more and more mainstream. Just a few months ago, we talked to a lot of our clients, and they loved it simply because if someone got the flu, one of their employees got the flu, we all know that within the first 24 hours, you can get this amazing drug in your system called Tamiflu. And if you don't get it in your body within the first 24 hours, Tamiflu is no longer a very effective drug. The question is, if anyone got the flu, how easy is it to get out of your bed, get to the doctor, get the prescription filled all within 24 hours when you're just feeling like you can't move? So having Teladoc and telemedicine is tremendous, as you can actually have a visual or a call with your provider, telemedicine provider. And if your pharmacy it has delivery service, they can deliver right to your home, or your loved one could go, get it for you. And today, in regard to millennials, in 2025, 50% of our workforce will be millennials who have been brought up into this culture of using Uber for their rides, DoorDash for their foods. Some use dating apps to date. And today, telemedicine, not just because of COVID-19, but it's becoming more and more a culture today. As I mentioned before, if you have any questions, please put it on the panel. And once we're done, Madison and I will answer all questions. Telemedicine, it's a remote delivery healthcare service by the internet, telephone, mobile app. And today, there's close to 200 telemedicine networks and 3,500 service sites currently exist in the healthcare field. Some of the areas in which you can utilize telemedicine are general health, dermatology, behavioral health. Not all plans that are embedded with your medical plan offer all of that, and Madison will talk a little bit more about that in a few moments. But the whole idea about utilizing the virtual and online capabilities, I'll look at dermatology, for example. In many cases, the doctor that you're speaking with is using FaceTime, using photos. So if you have a dermatology issue for you or a loved one, you can go in and basically speak to the doctor about it. In many cases, the doctor may prescribe some type of topical cream, maybe with an antibiotic into it. If the doctor feels that this requires an in-house service, then they're going to either refer you or you go to your dermatologist, and they can provide other, such treatments, whether it's Accutane prescriptions or, something more advanced. So they know when to gear the call over to a live professional. This has certainly increased employee productivity. And for the folks that have self-funded medical plans or have level-funded medical plans, in most cases, even though the volume of claims are a lot of the teledoc type of claims, they do add up and they go on your claims. And when you use telemedicine, you can keep it off of your claims experience. And that has a huge impact on your insurance renewals as it relates to your reinsurance carriers. And a lot of today's medical carriers are not including that in the pooling costs of the medical insurance. So to better understand how this all works, I'd like to hand the presentation over to Madison Hibbler from Teladoc.
Thanks, Steve. So, thank you guys for having me today. I'm just going to kind of go over a little bit on our company. My name is Madison Hibbler. I work in the broker channel here at Teladoc. So as you can imagine, things have been pretty busy the last couple of weeks, just with everything that's going on regarding the coronavirus and everything with the healthcare climate in general. So some of these slides that I'm going to show are actually from one of our national webinars that we had earlier in the year regarding some of the predictions for virtual care and telemedicine in 2020. And then obviously, since things started to kind of evolve around COVID-19, we've started to kind of make adjustments as needed so that we're able to really keep up with the growing demand that we're now experiencing. So first, I'm just going to share a little bit about our company. Actually, if you could go back one slide. Yeah, there we go. So Teladoc Health is currently the virtual care leader in the industry. We're the only publicly traded telehealth company. And because of that, we really hold ourselves to some very high standards, just of transparency and accountability, super dedicated to the value that we're able to provide through our services for our members. We do have more than 2,400 employees located worldwide. Our corporate headquarters is in New York, and then we also have offices all around the world. I actually work in the Phoenix, Arizona office, so that's where I am calling in from today. And we deliver care spanning more than 450 medical subspecialties across more than 130 countries and up to 30 languages. In 2019, we had a little over 4 million virtual care consultations total. And this year, we were projected to hit around 10 million. But I am assuming this number might be a little bit higher now that there are growing concerns just based on COVID-19. But the good news is that we do have the technology and the scale to be able to support this kind of unprecedented volume. So we have some different channels here at Teladoc Health. I work in the broker channel where we offer virtual care services on a direct basis, so completely outside of the health plan. And then I'm sure, as Steve was mentioning before, and a lot of you are probably familiar, that we do partner with a lot of health plans as well. So we're embedded in a lot of the carrier plans as an added telemedicine benefit. And then we also partner with a lot of hospital and health systems as well. So we've always believed that virtual care is just an essential part of healthcare, and now more than ever, people are really starting to see why. Around the world, the pace of the industry adoption is accelerating, and this growth is really driven by three impactful forces. So you can see them here: costs, clinicians, and consumers. Employers predict that healthcare costs are going to increase by 6% in 2020. And this is largely driven by chronic and complex diseases, which includes mental health, which actually accounts for around 90% of U.S. healthcare spending, according to the CDC. So we're now seeing that plan sponsors are really seeking ways to bend the cost curve and just make healthcare more affordable, and virtual care is an important part of that solution. Clinically, we're faced with a shortage of physicians, both primary care physicians and specialty physicians, and especially right now with such a big demand, a lot of people live in what we like to call primary care deserts, where they don't have access to a local PCP, or maybe they have to drive several hours just to go and see them. And then also the population is aging and life expectancies are growing, which is ultimately leading to more patients that are needing to seek care. At the same time, more clinicians are retiring from practice rather than entering it. So it's actually a worldwide trend with an estimated shortage of 4.3 million clinicians. And the impact from this can mean, limited or no access to primary care physicians or specialists, and then also significant wait times and shorter appointment times. And then concurrently, consumer expectations for digital health are continually rising as well. Consumers expect the convenience of accessing all kinds of services, and this includes healthcare, specifically by mobile device. And as the number of digitally native millennials surpasses those baby boomers, in these coming years, we really should be expecting consumer expectations to also rise as well. With economic, clinical, and consumer dynamics favorably aligned, now is really the time to invest in an innovative virtual care strategy that truly transforms how people are able to access and experience their healthcare. So this slide here, let's see, we can see that according to the 2019 AHIP Virtual Care Survey of Health Plans, nearly 100% of the health plans that were surveyed believe that the importance of virtual care is increasing. A vast majority are currently offering virtual care services for things like behavioral health, acute care, and even chronic care. And then additionally, other virtual services are now being added for things like wellness coaching, complex care, and even pediatric care as well. So here we'll kind of dig into what's happening today and then touch on what the future looks like. As we look at what's happening today with those economic, clinical, and consumer dynamics that I had just mentioned before, organizations around the world are exploring virtual care and most are undertaking deployment. The importance of virtual care is increasing for nearly all U.S. health plans, and majority are already offering or considering offering virtual care services. 64% of U.S. health systems currently have a consumer telehealth program, and an additional 24% say that they will offer consumer telehealth by the end of the year. So we can really see that the pace of virtual adoption is really accelerating quickly, and an explosion of startup suppliers have even entered into the market. More than 165,000 mobile apps for health are now available worldwide. So 165,000 is quite a lot, but very few of these startups actually have the services, scale, and track record of success that's required to help organizations achieve that full potential of virtual care. So as we look into the future, virtual care becomes a central strategy for expanding access, improving outcomes, and really controlling costs. To maximize the value of virtual care, organizations are going to require partners with the leadership and capabilities to deliver on ever-increasing expectations with the broadest spectrum of clinical services, highest clinical quality, scalable platforms, and the expertise needed for continual innovation. And then beyond acute care for non-emergency conditions, virtual care has a growing appeal for people with more complex needs. So things like mental health, dermatology, and physical injuries, such as backaches. And as more consumers use virtual care, expectations will continue to rise as well. While today's virtual care satisfaction is largely driven by customer service factors, such as quality of the phone experience, the digital experience, it's clear that consumers actually want to access more healthcare services virtually. We actually did a recent survey. 1 in 4 people said that limited services made it difficult to use virtual care. And our data shows that when members can access multiple clinical services from that same source, they're averaging about 5 times as many visits as those who have access to just one service. And then as digital native generations age and have greater healthcare needs, they're going to look to virtual care to satisfy those expectations for that effectiveness and convenience factor. Not to mention, data and analytics have started to enable consumer engagement programs to be more personalized and contextualized to motivate greater utilization. So there's even things like AI-enabled assistants that are going to gather information in order to really tailor that experience and guide people to the best path for care. So increasing our consumer satisfaction will in turn also increase utilization of the virtual care services as well. Our general medical program covers a wide range of non-emergency conditions, such as the ones that are included on this slide. A study that was done by the Wellness Council of America states that 70% of all emergency room, urgent care, and doctor's visits can actually be safely handled over the phone or with a smartphone app. So that's nearly 3/4 of people in the emergency room that just simply don't need to be there. With virtual care, you don't have to take that half or a full day off of work, and you don't have to sit and wait in that germ-infested lobby with other sick people, potentially exposing yourself to even more illnesses that you didn't even have in the first place. Especially right now with all of this coronavirus stuff, I know I want to avoid hospitals and doctors' offices as much as possible. So with that being said, currently, every consultation with our doctors at Teladoc is starting with a symptom check for symptoms relating to COVID-19. And if the member's symptoms show that this could be a potential case, our physicians are then going to notify the appropriate public health department in accordance with local reporting requirements. And then that public health department is then going to take the lead to really initiate that diagnostic testing and guide people on any at-home self-monitoring, at-home supervised isolation, or quarantine requirements. And then for cases where in-person care is needed, we are going to help navigate the patients to appropriate resources, potentially in network where it's possible, and encourage patients to let them know before they go. So that way, you know, the in-person care facility can then direct them appropriately and minimize potential exposure for others. So here are some of the common prescriptions that we see with telemedicine. As you can see, our physicians are unable to prescribe any DEA-controlled substances or lifestyle drugs. And this is just because we do take the situation very seriously, and we want to make sure that members aren't abusing the benefit, but are also able to get the appropriate care that they need. And quick stat at the top of this slide, in 2017, 29 states were able to offer telemedicine as an insurance benefit. And now today, in 2020, telemedicine is able to be offered in all 50 states. Our network is continuously expanding, and 65% of employers plan on adding telemedicine to their healthcare offerings by the end of this year. And then in terms of cost savings, we're seeing the biggest ROI, like you had mentioned earlier, when it comes to redirecting those large urgent care or emergency room claims. So a lot of the times people are, going to the ER when it's a non-emergency condition just because it might be the middle of the night, or they can't get access to their PCP for a couple of weeks. So by providing the convenience of telemedicine at 24 hours a day, 7 days a week, then they're able to avoid those large costs by utilizing our services instead. And then the average cost of virtual care plans on a direct basis ranges from about $2 to $20 per employee per month. And this just kind of depends on the types of services that employers are looking to offer their employees. And then the last slide that I'm just going to touch on here, this year it's predicted that 7 million people will use telemedicine, which is a huge increase based on years prior. And then we're also helping physicians to see more patients in a shorter amount of time while still making the proper diagnosis. And then, Steve, I'm going to hand it back over to you if you want to do the demo for Teladoc.
That'd be great. Thanks so much, Madison. So what I wanted to do, rather than showing it through a PowerPoint slide, I always like to do a live demo. So no pressure, everybody. But what I'm going to do is log in to the site using myself. Now, when you utilize your Android or your Apple phone, your iPhone, you get a really good quality, picture on how this all looks, and you get to use all of the geofencing as it relates to where you are at the time, which helps out with prescriptions and so forth. So I'm going to log in and put my password. Okay, so if I wanted to update my profile, so when a Teladoc representative is about to review my history, they can go take a look at my medical history. If I wanted to change or add a pharmacy, I can go in and basically add the pharmacy. So I have right now in here as my listed pharmacy a CVS in Aberdeen, New Jersey. But if I had my location service on and I was in, let's say, Orlando, Florida, and I needed to get a Z-Pak, the provider who would send that request into CVS, it would know to find the local CVS as close to where I am as possible, which is a great convenience. So the more information you put on here, the more that the Teladoc's going to have some history from you, which is good, because a lot of times when you go from Dr. A to Dr. B to Dr. C, they don't always have that history file. So here you have the history that's built up. So with no further ado, I'm going to go in. I'm going to request a visit. And what's sad is a couple of years ago, I had my kids on here. Now, once you turn 18, they come off and they have their own. So by law, they have their own Teladoc. So again, if it knew based on my geofencing, it would know what state I'm in. So I'm going to indicate here. And what type of visit? I'm going to go with a general medical versus the other two options, dermatology and behavioral health. And what's the reason for the visit? I don't want to get anybody in an uproar and put in COVID-19. So in the spirit of keeping those type of calls at a minimum, we'll say I have a sinus infection, and I'm going to want this done by phone. I have a choice by video. And now, because of the amount of demand, it says due to extreme high demand, we're not allowing to schedule visits. So what's nice is if it's 3 o'clock, 3:23 here on the East Coast, I have to work till, say, 6 o'clock. I can schedule my visit for 6:30 when I get home. But because of given the highest possible volume the telemedicine companies have ever experienced is probably right around now, it's basically telling it's going to call me back as soon as possible. I actually did this Sunday, believe it or not, for a sinus infection, and within 20 minutes I got a call back. So I want to call as soon as possible, and I'm going to want to get that call to my cell phone. And I'm going to want to use my pharmacy, and always ask this question, without virtual care, where would I have gone? I probably would have gone to urgent care, right? I hit continue, and if I missed any field, it's going to let me know that I missed that field. I did great. Now, here's something real important. It told me that the bill for this is zero. So, and this really matters on how you set up your Teladoc. So we as a company, we set ours up we have about 150 internal employees, and we have this through Aetna. However, Aetna forces our employees to pay a $30 copay. Right. I know a lot of them are changing things right now, given the state of the country. But when you have the employee pay zero, in my opinion, it gives them more motivation to use telemedicine. So if I had here what Aetna suggested, a $30 or $40 copay, I may want to get my car and drive to the urgent care, and maybe I want to see a live doctor. So this certainly motivates me. Zero is a good number, and so we pay a little bit more per employee per month for the service. If I want to have the employees contribute a little bit, then we pay a little less, for the monthly bill. I hit continue, and it's going to review everything. I have to check my disclaimers, and once I do that, I hit continue, and I should be all set. And I am. I got my confirmation number. And what I'm going to do so I don't drive the Teladoc crazy, I'm going to go back here, and I will take a look. Once we're actually done, I'll go back and I'll just do a refresh on here, reload. And I'm going to take my visit that I just made, and I'm going to cancel it. Last thing I want to do is have a doctor make an unnecessary call right now. And what happens if that doctor felt, and I did this on Sunday, as I mentioned, I kind of diagnosed myself as having a sinus infection. They ask all the right questions. If I don't answer them correctly, they're not going to prescribe me what I felt was a sinus infection. So in this case, the doctor felt that it was a traditional sinus infection, and he sent my prescription to the CVS over in Aberdeen, literally about a half hour after my call, and it was ready for pickup. That's how convenient this program is. So what you just saw is a live demo. It doesn't get any more real than what I just showed you. And what I wanted to do is just open up in a few moments with any questions you may have. And by the way, if you want more information regarding Teladoc or how this all works, you can at any time send an email to Melissa Cook, melissa.cook, COOKE, at TritonHRO.com, or give us a call at 877-OK-Triton, and then we can give you all the information you need with Madison and figure out what's the right plan, right program for you as well. So what I'm going to do is I'm going to take a look at some of the questions that came up. We wanted to make this presentation, a half hour. And let me open this up. The first question is, Corey has a question regarding copays. Corey wants to know what's the best recommended, to have the employees pay a small copay or make it at a zero cost for them, something I just discussed a few moments ago. So, Madison, you want to take that one?
Yeah, I think you kind of explained it a little bit earlier too, but I would say the $0 copay just really helps to increase utilization when it comes to members actually wanting to try this out, just because sometimes people are a little bit hesitant to try things that they've never done before. So if they aren't used to telemedicine, they're used to going into their local PCP, they might be a little bit more hesitant to try this out if there is a copay. Especially if that copay is pretty similar to what they would pay at their regular PCP. So if they do have that $0 copay, they're probably going to be more likely to try it out, because best case scenario, it gets resolved and then they don't have to go to a PCP or an in-person physician. Worst case scenario, they don't have to pay anything and it's free, and they get a second opinion. So I think that the $0 copay is a great option.
Great. Madison, Sonia has a question. Does telemedicine information transfer to your primary care physician? So I'm going to have you answer that as well, if you don't mind.
Yeah, so you can do it either way. There's actually I'm not sure if it's on the website as well, but I know from the mobile app, it gives you an option to check a box if you want all of the information from that consultation to go back to your PCP, and then you can input your PCP's information as well. That way they can send everything over to them to review.
Great. Linda, your question regarding is a webinar being recorded? It is, and sometime later tonight, Tina from my office will upload it to our website under media. Is Teladoc owned by Aetna, Sonia wants to know, or just partnered?
We're just partnered.
Great. Ella has a question regarding which is better. My carrier now offers a telemedicine as part of our group medical plan. Is it best to use theirs or contract outside using a company like Teladoc? Good question.
Yeah, and I think that would be basically dependent on the employer and just kind of what services they're looking to offer their employees. So let's say they had an embedded plan that had general medical, and they were excited about that, but then they wanted, a behavioral health piece, and then they wanted expert medical services for chronic conditions, things like that. Then they might want to add a telemedicine benefit as a standalone option alongside that embedded option, so that way members have access to all of these services that they weren't originally getting with the embedded.
Okay. There's another question. Given COVID-19 forcing CMS to allow for telehealth care, do you think this genie is out of the bottle long term? What are your thoughts on that, Madison?
Can you rephrase that? I'm not really sure.
Yeah, it seems like given that COVID-19 is forcing the CMS to allow for telehealth, do you think it is out of the bottle long term? So, in other words, do you think now this will be more long-term solution or short-term play?
I think it's always been kind of a long-term solution. I think that, everything regarding COVID-19 right now is kind of up in the air, and it's kind of just a learn as you go type thing for everybody. I know it's kind of we weren't prepared for this to happen, but since we are, one of the only publicly traded telehealth companies out there, we're really doing our part by partnering with the CDC and making sure we're keeping up with protocols and making sure that we're getting members the best care during this time.
Great. Thank you. Allison has a question regarding proposal and setup. How do I go about requesting a quote? And if I move forward, how quickly can we get it set up for some of our employees? They can use them as soon as possible. So I'll start off with this one. I would tell you getting out a proposal is relatively easy. Within 24 hours, we can get a proposal sent out. We have two ways to get our clients set up. One, we can put them on our in-house system immediately. So it's conceivable within 24 hours, your employees can utilize this and start having teleconference calls with their providers. We do this again through Teledoc, and then we would look to transition and put a live contract directly through Teledoc. Outside of those options, Madison, do you want to take a shot at that as well?
Yeah, so we have two platforms that are available through Teledoc. So Teledoc Health is our parent company, and then we offer both Teledoc and HealthiestYou. So the turnaround time on Teledoc, right now we've tried to shorten the implementation time a little bit just because of everything that's going on. Usually it takes about 30 days to get a group started with Teledoc, but as of lately we've been doing about a week to 2 weeks. But we also have our HealthiestYou platform, which always takes only about 3 to 4 days to get somebody set up. So it's a lot quicker process on the turnaround time for HealthiestYou.
Great. Yolanda has a question regarding an example of costs for medical clinic. So I'm going to assume that would be for general medicine. Yolanda's asking.
I'm sorry, say that one more time.
Yolanda has a question. Can you give me an example of a cost for a medical clinic? So
for a general medical consultation, is that what?
It sounds like, yeah.
Yeah, so we do have the option to either do the $0 copay or we could do a $49 copay on the general medical visit.
Okay. How well does this work for a small ophthalmology practice? That's from Sydney. So, Sydney, I'm assuming that a small practice, meaning for your organization, what the cost structure would look like. I think where Madison was kind of going with this is it could range anywhere from $2 to $20. I would tell you my company, we pay, I think, like $9 for an employee, but we have a zero copay for general medicine as I mentioned earlier, to motivate them to use it. However, if they want the dermatology or behavioral health, then we put a $50 copay in front of that, and that's what kind of keeps the cost to a minimum. I think that's it for questions at this time. We've just come in about 4 minutes over schedule, so at this time I'd like to conclude our presentation on telemedicine. We'll be presenting the same content tomorrow at 3 p.m. should anyone else in your organization want to learn as well. I want to thank Madison from Teledoc for being part of our presentation today, and I want to thank everyone for attending. I hope you're now all subject matter experts in the area of telemedicine. Have a great rest of your day. Bye-bye.
Thanks, Steve. Thanks, everyone.